Hello everyone, I'll be talking about meningitis. So meningitis is the inflammation of the central nervous system, particularly the meninges that surround the brain and the spinal cord. It's caused by multiple types of infectious agents, and so it's classified depending on the type of agent that's causing the initial infection. Bacterial and viral are the most common form of meningitis, but fungal, amoebic, parasitic, and non-infectious are also types of agents which can cause the infection as well. They're just not seen very much, and they're considered very rare, specifically non-infectious, which is when anything such as cancer that is non-infectious can cause swelling within the meninges. For this slide in particular, we're just going to talk about bacterial and viral meningitis because those are the most commonly seen. So for the infectious agents of bacterial and viral meningitis, these are any types of bacteria or viruses that have the potential to cross the blood-brain barrier and therefore gain access to the spinal cord and the brain. And listed here are the most commonly seen bacteria and viruses in the United States that cause meningitis. Streptococcus in particular is very common amongst all age groups, and other bacteria, depending on the age, have more susceptibility within that person to reach the central nervous system. For viruses, the initial infection begins with the entrance of the virus. So for example, mumps, herpes virus, measles, morbid virus, these all develop the initial disease, and then should that virus cross over into the blood-brain barrier or the central nervous system in general, then you have meningitis as a result. So pathogenesis begins with the infective agent successfully colonizing within the host, and meningitis itself follows if that infection successfully invades the cerebral spinal fluid or the blood-brain barrier. One way for this to occur is once the bacteria or the virus has entered the bloodstream and therefore has easier access to travel to the central nervous system. In bacterial meningitis, studies have shown that pathogens possess effective molecular tools that are capable of bypassing the normal structures that we have to protect our central nervous systems. So for example, Streptococcus uses particular proteins, for example, CDPA, that promotes endocytosis, which is the absorption of that pathogen into the cells, or adhesion, which is the attraction of the cells to that pathogen and fuses it with what normally should have been a firm wall against such things happening. Following this infection of the central nervous system, the effects of the body's immune system will then kick in, and this concludes the leukocytes occurring, flowing to the location, and inflammation beginning with that process. Here I have a picture of a normal brain and a brain that has experienced advanced bacterial meningitis. On the left, the normal brain is protected by the meninges along with the spinal cord, but on the right, the meninges have invaded that space which normally protects the brain, and you can see the effects here that are characterized. So the discoloration, and you can see there's also decay within the brain in which the inflammation has caused. The signs and symptoms of meningitis usually appear 3 to 7 days after the initial exposure to the pathogen. And the most common symptoms are fever, severe headache, and a stiff neck. So for this reason, a lot of times meningitis is assumed to be the flu with the early symptoms. Additional symptoms that can occur are a rash, confusion, difficulty focusing, lethargy, nausea, photophobia, which is the severe sensitivity to light, vomiting, and under rare circumstances, seizures as well. Rashes are considered a key symptom or sign of identifying that meningitis is occurring with bacterial meningitis. And on the left, you can see a picture of a leg which has a rash, and a glass is being held up against it. It's a test that one can do on themselves, in which the pressure of the glass should normally cause the rash to disappear, but in meningitis, the rash will remain despite the pressure of the glass. And if this is the case, then doctors urge people to immediately seek medical assistance, so that way they can be treated for bacterial meningitis. This is because of the severity in which bacterial meningitis symptoms increase. So from the initial inflammation that occurs and the symptoms which occur after that, death can result within hours. And for this reason, doctors urge people who show any type of symptoms with bacterial meningitis to immediately seek treatment. Diagnosing meningitis, though, can be difficult, especially due to the 3 main symptoms, which are commonly associated with the flu. So many people will not initially realize that they have meningitis and might not even go to the hospital to get any sort of diagnosis made. And doctors, in order to actually confirm whether someone has meningitis, can only use one method for an assured identification, and that is the spinal tap or a lumbar puncture, in which the cerebrospinal fluid and sometimes the blood surrounding the spinal cord is extracted and then analyzed for the presence of pathogens that are known to cause meningitis. In some cases, doctors can also suggest using a stool sample or a swabbing of the nose or the throat, but these aren't assured methods of diagnosis. They are just ways to analyze whether the presence of pathogens known to cause meningitis are present. The only way to know for sure whether the symptoms that you are experiencing is meningitis is through that spinal tap or lumbar puncture. Once a person has been diagnosed, then treatment begins immediately, especially if they have bacterial meningitis. In the case of viral meningitis, because it is a virus causing the disease, there isn't much treatment that can be offered. Most people, though, recover by themselves, and many don't even go to the hospital to see a doctor because of this. And they recover within 7 to 10 days after the initial symptoms set in. Some infections, though, such as those caused by herpes virus and influenza, do require antiviral medication in order for them to have a full recovery in most cases. Meningitis, on the other hand, is very different. Once doctors have diagnosed it, they prescribe a number of antibiotics immediately in order to offset and combat the rapidly developing symptoms and hopefully offset any sort of lifelong difficulties that may occur following this meningitis. If the bacteria causing the disease is not known, the doctors will prescribe a broad spectrum of antibiotics just to cover all the bases from the beginning. Once recovery has occurred, viral meningitis does not normally leave behind any type of lifelong conditions. They make a full recovery in general and are capable of continuing forward as if nothing ever happened. Unfortunately for bacterial meningitis, patients often experience lasting nerve damage because of the severity in which the inflammation has occurred, and this can result in a variety of conditions. The most common are gangrene, deafness, and learning disabilities. The gangrene and deafness due to nerve damage that has occurred, and learning disabilities because of the death of brain cells of the inflammation that has been surrounding the brain. Prevention for meningitis, because it is caused by so many infectious agents, really relies on the same protective measures that are used to combat those same pathogens that cause the initial infections themselves. For example, namely, vaccines are the most effective version of prevention, and proper hygienic practices as well. So those who are most susceptible to the disease are those who are immunocompromised and the young, so vaccines are especially important to protect those people from ever contracting the virus and bacteria, and then potentially meningitis, which can be fatal. Proper hygienic practices are, as normal, washing your hands and also making sure not to eat any sort of food that might be uncooked, things like that could prevent you from contaminating or causing infection within yourself. The CDC also recommends additional healthy habits just to increase your own immune strength against infections. This includes refraining from smoking and using bug spray when at risk for bug bites to prevent any sort of vectors that may potentially cause infection by injecting you with pathogens. The CDC keeps an active dialogue of all cases of bacterial meningitis that occur within the United States. They require for all confirmed cases to be reported to them in order to collect the data and analyze it, hopefully for greater understanding of the epidemiology of the disease, and hopefully develop greater preventive measures and treatment methods for those who do contract it. According to this research that was done and cataloged over the years, as you can see, the last year was 2016, and there was an all-time low of 370 cases within the United States of bacterial meningitis. This one specifically was cataloging meningococcal, which is the Streptococcus bacteria that causes meningitis, and this being the most common is a great sign showing the progression of preventative measures in preventing meningitis. And that is all for my research. Thank you very much.